Good day and welcome to another insightful edition of Earth Matters on Daily Insider TV. I remain your humble Earth commentator, Yusuf Yako. Apart from the pleasure, enjoyment, fallacy, and ecstasy of sex and sexual activities, do you know that having indiscriminate and unprotected sex makes you at high risk of contacting some dangerous, health risky infections and diseases? Join me and follow me as I take you on a journey of what sexually transmitted infections is. Sexually transmitted infections are infections or diseases that can be contacted through sexual intercourse through sexual intercourse with infected person. When you have sexual intercourse with any infected person who has any sexual transmitted infections, you are at high risk of contacting STIs, which means sexually transmitted infections. Examples of these sexually transmitted infections include chlamydia, gonorrhea, syphilis, genital herpes, vaginitis, and also HIV/AIDS. There are some of these diseases that are curable, and there are some others that are not curable. Apart from that, before we go to this end, what are the symptoms of these STIs? The symptoms of these STIs include having heavy vagina, which is discomfort in the vagina for a female. Sometimes for a female, you'll be having itching and burning feeling while urinating. Also for a male, a male that has STI will be having burning and itching feeling while urinating. For a male and for a female also, when having sex, instead of having pleasure, you'll be feeling pain in your private parts. Discharge also, although we have bloody discharge. A woman having STIs will be having bloody discharge all time. There are sometimes irregularities during menstruation. A woman with STI will be having irregular menstruation. A menstruation that ought to end 3 days is taking more than 5 days. You should be careful of yourself. Some other things you can develop is stomach pain. Sometimes for a male, you'll be having the feeling of urinating every time. These are some symptoms. The symptoms also includes having pus. Having pus in your private part always. When you discharge pus or you see pus at your private parts frequently, that means you are showing symptoms of STIs. Some of our youths today are negligent of sex. They have sex with many partners. If you have sex with many partners, you are at high risk of contacting STIs. What are the causes of these STIs? The causes of these STIs includes bacteria and some viruses. These viruses lives or they found their dwelling place at our private parts. When you have sex with someone who has contacted these diseases or infections, and you have sex with them, you may contact these key health conditions. Apart from all this, there are some other ways you can contact these STIs, which is sharing of sharp objects with infected person. If an infected person used a blade or a needle and you also use it on a person who is not infected also use it, you are at risk of contacting disease. There are sometimes a baby may contact it from his mother, which means a person, a baby who is free from having STI can contact it from a mother, maybe through in pregnancy. Aside from contacting these STIs through sexual intercourse, a person can also contact it while sharing sharp objects with infected person. A baby can also contact it from his or her mother. These are various risky conditions for a person to contact these STIs. Apart from all that, also there are some hospitals, or maybe there are some transfusions that are not compatible. If you take blood which is not your blood, or a blood of someone that is infected with any STI, you are at high risk of contacting these STIs. Why this STI should be put at high alert is that our youths today, they are very negligent to the extent that the pleasure they see in having sex is giving them this hint that they can do anything. If you are someone who has this the mentality of having sex with anyone you see, you should be very careful. Because there are some STIs that are not curable. For example, someone having hepatitis B, which is one of the most dangerous sexual transmitted infections ever. If you have hepatitis B, you are at high risk of having it for life, which means it will be life-threatening until you die. What of someone who contacted AIDS through sexual intercourse? If someone has contacted AIDS through sexual intercourse, AIDS, if care is not taken, it kills gradually and end up killing someone who has been infected. So these are why you should make sure you have protected sex. If you are someone who cannot have sex, who cannot do without have sex, if you are addicted with having sex all the time, make sure if you want to have sex, you use protection, which is using condom, and it is advisable for you to have just only one partner. And if you can't, make sure you are protecting yourself, because it is good to prevent all these sexually transmitted infections. It will not be good for you to develop these sexually transmitted infections and end up in hospitals or spending money that are not necessary. May God bless us all. Have a nice day.